This is The Road Out, Understanding Addiction and Recovery for You and Your Loved One, with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine, Cottage Health of San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine, Cottage Health. Today we want to talk about how to support someone after treatment. So if someone completes the treatment we talked about last time, should they expect they are better and they'll stay sober and they don't have to do anything and everything will be hunky-dory?
Not necessarily. So very often at our cottage residential program in Santa Barbara, people are feeling much better by the time they complete the program. Families are very involved in the program and they're starting to feel better. And often people go home with the idea that everything is now improved and going to stay better, but that's not necessarily the case.
No, not at all. And that's one of the things, when we had talked earlier about finding a quality program, part of what makes it a quality program is, are they involving the family? Is there an opportunity, is there a group, say, involving communication that family members can attend? Because that allows people to sort of get prepared, because things are going to be different when this person leaves residential and comes back home. And oftentimes, people have a problem adjusting to change, even if it's a good change.
And for people with drug and alcohol problems, they are managing this disorder over the long term. It's not like an episode of pneumonia where you get your antibiotics and you're cured. It's a chronic illness that you are learning how to manage every day. And there are going to be times when people will slip and relapse and have to get some help again and get on their feet again. So it's a kind of condition where you're not done once you've finished a treatment program.
No, not at all. And I think for family members particularly who have oftentimes witnessed the addiction, been very happy if someone's gone into treatment, when that person comes out, if there are some issues or some ups and downs or even a relapse, oftentimes family members really can react very strongly in a very negative fashion about that, because they aren't expecting it. But Dr. Erickson's right. This is a chronic illness. This is a chronic illness. This isn't you're getting treatment and everything's fine now.
What do you do if someone is taking the medicine, they don't like the side effects, and now they feel better and they stop taking the medicine?
Well, and that happens, and that's if you are witnessing your loved one doing this, and let's say you're noticing, gosh, they usually take X medication at breakfast while we're sitting and talking in the morning, and you notice they're not anymore, or you see the pill bottle and it's obvious that it's not getting emptied. You ask them, hey, what's going on? Now, they could have reached a point in their treatment where they and the doctor who's prescribing the medication has said, you're doing good, we can stop this and let's see how you do.
Very often, people in a family try to do the work of being sober for the individual. They try to fix the person, and you can't do that.
You can certainly ask, hey, what's going on? I've noticed that you're not taking your medication, or I've noticed you're not going to AA as often, or it seems like you're not seeing your therapist. I think it's fine to ask, but then that's sort of it. I mean, as you're saying, they have to own their sobriety.
What if they relapse and you can't take it anymore?
Well, that's where you need to be, and I really encourage family members, especially if it's a spouse and it's been a very difficult time as far as dealing with your loved one's addiction. I often encourage them to see a therapist on their own, to get some help, to figure some of these things out, to have a plan.
And you as a family member need to know your own limits and your own breaking points. There are times when a problem has been so severe and so difficult that if a person is not really pursuing their sobriety, and if the consequences continue to pile up, a family member may need to make a big change, like ending the marriage or moving out, and you need help to wisely make those decisions.
Right. Right.
Okay, we've been talking The Road Out, Understanding Addiction and Recovery for You and Your Loved One, with Dr. Margaret Bauman, Medical Director, Psychiatry and Addiction Medicine, Cottage Health, San Luis Obispo Outpatient Program, and Dr. Paul Erickson, Medical Director, Psychiatry and Addiction Medicine of Cottage Health. To listen to this program again or share with a friend, visit cottagehealth.org/The Road Out. That's cottagehealth.org/The Road Out.